I always tell this story because this was just one of the most, it was just a really touching experience that I went through with a family member. I had a patient, I was meeting the patient and the family as he was being admitted into a skilled nursing facility. He was coming from the hospital, he was very ill, and he was going on to hospice care. And so I was at the nursing home waiting for them to arrive, and then the daughter came in, and the patient came in, and I could see him on the gurney. He was very sick. And the daughter comes up, and she's like, I need to talk to you right now, right now. And she was just a mess. She was just frantic. And she says, you know, yesterday when I made this decision to choose hospice for my dad, he was unconscious. But today he's actually awake, and I'm afraid I've made the wrong decision. And I said, well, he's awake. Let's go talk to him. And so she did, and I sat by, and she just lovingly sat down, and she said, you know, Dad, the doctors have said that your organs are failing, and that your condition is really poor, and that there's not much hope for you to recover at this point. And I chose hospice care for you. But I need to know from you, is that the right thing? Is that what you want? And this man, he was really struggling to breathe. He was having a hard time, and he's sitting there, and I could see him taking it in, and it took him a long time, and I'm like screaming in my head, answer the question. Finally, he says, it's time to go. And when I looked at that daughter, it was like the burden of the world got lifted off of her. I've never seen someone just go from so much stress to so much peace in so quick of a moment. And it made the rest of the decisions, everything else along the way, so much easier. And so I really encourage everybody to have that conversation with your family members about what you want. It's not an easy thing to do. And then you can document it, put it on paper in the form of an advanced healthcare directive. An advanced healthcare directive is a legal document. You can download them from the internet. There's a number of different sites that have these available for you. There's California Coalition for Compassionate Care, have them, but you can just put in advanced healthcare directors on Google, and you'll probably get, 3,000 sites that would have something available for you on that. And what the Advanced Healthcare Directive does is to appoint a decision maker should you not be able to make a decision. And that can be a family member. Some people may choose to not have a family member make that decision for them. Should be someone that you trust will make the decisions that you want made for you. It also states what you want. So if you do not want resuscitation and aggressive treatments if you are terminally ill, you can state that in there. If you want everything, you can state that in there as well. So to choose your agent, what you want to choose is a person who is familiar with your personal values and willing and able to make decisions for you. Someone who travels to Europe 9 months of the year is probably not a good candidate to be your agent. It's a good candidate to be your friend if they can take you along with them, but not your agent. It may or may not be your closest family members. Tell others who you choose and why. So when it comes time. My grandmother chose my father to be her decision maker. She has 6 sons, or 6 children, but he was the oldest, so he was the one who was selected to make the choices. So, everybody knew if something happened that it was my dad that would be called in to make the decisions. And you can also select an alternate decision maker, which I would highly recommend because people do leave town or go away or are not available. Now, in the event that you don't have an advanced health care directive, who would make the decisions for you? California law says that a family member can make decisions for you, usually a spouse, a parent, a sibling, or an adult child can make decisions for you. It doesn't give any particular order. And, sometimes family members disagree on things. And, we've seen it where there's been, it actually has become a federal case, where, the Congress gets involved in these matters. So, it's good to have the stuff written down. Other kind of instructions you can put on there. I'd like to die at home. You can put where, what you would like. You can put if there's a particular physician you want to be involved in your care. You can put the acceptance or refusal of life-sustaining treatment. Quality of life considerations. You may also include organ and tissue donation instructions. So with this document, what you do is you're going to give a copy to the person that is making the decisions. You do not need a lawyer to complete an advanced directives. You can get 2 witnesses to sign it and it's official, or you can get it notarized. And so once you have those in place, that's what it is. You can change it. You can change agents. It's a very flexible document. Many people need to change it as their conditions change. When you're 65 and you're out on the golf course, and if I have a heart attack on the golf course, of course I want resuscitation. But, when I'm 80 and I have cancer, maybe resuscitation doesn't fit within my goals right now, or within my quality of life considerations. So you would change it. So your physician should have a copy. Keep a copy yourself. If you go to the hospital, you should take a copy of it to the hospital. And the photocopies are valid. This is, I think, really important. Your values and beliefs should guide medical choices whenever possible, not the other way around. And I think it's kind of the direction we've gone, and now we're coming back the right way. And then we have one other form, and it's called a POST form. Okay, is anybody familiar with this? If people are in skilled nursing facilities or have within the medical system, they may be familiar with this form. And this is more for people who have very advanced disease, residents of skilled nursing facilities, someone who's frequently been in hospitals or so forth. I see someone has one in their hands right there. Can you hold that up for me? It's a bright pink form like that. And what a POST form is that it is an order from a physician for care should you stop breathing or your heart stop beating. But it is actually an order that can go from you from one facility to another to direct the caregivers on what you want. It's a little bit more specific than an advanced directive. It's still, your agent still is involved in decision making, even with a POST form in place. And if you are ever admitted into a skilled nursing facility, you may be asked to complete one of those. Who needs it? That's more of the chronic progressively ill people. And for people with a serious health condition and the medically frail. And these are just some of the distinctions. I won't go into that so much. And the copy stays with you. The original pink always stays with you. So if you're in a nursing home and you go to a hospital, the form goes with you.